Hi, everyone. Welcome to PAME's webinar on Becoming an Advocate, Personal Stories and Practical Tools for Impact. We have an engaging conversation planned on epilepsy advocacy, and we'll explore how individuals and organizations can take action to drive change. We'd love to see where everyone is joining us from because that's a really important part of advocacy. So please share in the chat where you're joining us. I'm based here in Chicago, Illinois, where we're having a lovely fall day, kind of fake fall. But we want also your questions during the webinar. So please submit them using the Q&A box, and our panelists will answer them, and I'll ask them during the webinar. And just as a reminder, we're not able to give specific medical advice, so please keep your questions general in nature. And if you do have specific medical questions, always bring those to your healthcare team. They're the best people to answer those questions. So I'm Allison Kukla, the Senior Advisor for Outreach and Education at PAME, or Partners Against Mortality and Epilepsy, and I'll be your moderator this afternoon. Just a few housekeeping items before we get started. Like I said, throughout the webinar, just please put your questions in the Q&A box. You don't have to wait until the end. It'll help us track them, and the panelists can answer them when they're not speaking as well. And if there's a question you really want answered live, you can upvote that question in the Q&A box, and we'll be sure to ask it during the webinar. We also encourage connection. Advocacy is all about connection and coalition building. So, you can connect with others in the chat as well if you see familiar faces or familiar names, rather. And then lastly, we are recording today's webinar, and it'll be available within 24 hours. So I'll send an email out once it's available, and we'll put it up on our YouTube page as well. I'm very grateful for our speakers who are with us today. All of them are dear friends of PAME and myself. And so I'm excited that you all get to meet them and that they're joining us for this important topic. So during this webinar, we'll begin with a powerful lived experience from Lou Brossard, an epilepsy advocate, followed by presentations on key advocacy tools from PAME and partner groups by Katie Collins, and insights into current state-level efforts and how to get involved by Dominique Brown. Whether you're new to advocacy or looking to deepen your impact, this session will offer practical guidance and inspiration on, how to keep getting involved, or, how to get your foot in the door to start your advocacy efforts. So I'll introduce our expert panel, and then I'll let them take over, and then I'll pop back on for Q&A. But first, I want to introduce Lou. Following the passing of their beloved daughter, Brenna, from SUDEP in 2022 at the age of 25, Lou and his family immediately decided to turn their grief into action. Since then, Lou has worked tirelessly on SUDEP awareness and prevention at the local, state, and national levels. His 17 years of experience as a legislator at the municipal level has opened doors for him to introduce pending SUDEP legislation in the state of Ohio. He remains fiercely committed to bringing SUDEP awareness to anyone living with epilepsy, as he recognizes there is critical information gap that exists within the medical community. Thank you for joining us, Lou.
Thank you.
We have
go ahead. I'm sorry.
No worries. We have Katie Collins, who is the Vice President at G2G Consulting and has been leading advocacy efforts in the epilepsy space for the past 3 years as the Government Relations Advisor to the Epilepsy's Action Network. Her background is in oncology and rare disease. She spent 6 years in the Obama White House, was the policy staffer for the White House Cancer Moonshot, and the program director at the Biden Cancer Initiative. Welcome, Katie.
Thanks for having me, Allison.
Yep. And last but definitely not least, we have Dominique Brown. She is a seasoned public policy strategist and nonprofit leader with over a decade of experience advancing legislative and regulatory change to improve the lives of underserved communities, particularly those affected by epilepsy and developmental disabilities. As Director of State Relations and Policy at the Epilepsy Foundation, she leads state-level initiatives nationwide, including the successful Seizure Safe Schools campaign in over 20 states, and efforts to expand Medicaid coverage for seizure detection devices, which we are very excited about at PAME. She holds a Master's of Public Administration and a Bachelor of Science in Social Work from Southern Arkansas University, grounding her work in both policy expertise and social justice. Dominique is based in Arlington, Texas, and is passionate about building coalitions and driving equitable health policy. Thanks for being here, Dominique.
Happy to be here.
Yep. So as you can see, we have a very diverse panel, wonderful expertise, and like I said, dear friends. So I'm glad to bring them all together and spend some time with them, and thrilled to introduce them all to you. So we can start with the first presentation. So first we'll hear from Lou, and then we'll turn it over to Katie, and then we'll wrap up with Dominique. But like I said, remember, keep putting those questions in the chat box, in the Q&A box, as you have the presentations going through. And we have time at the end for Q&A with all the speakers. So Lou, I will turn it over to you.
All right. Thanks so much, Allison. And as always, I love collaborating with you. Today will be no exception. You know, looking back on our family epilepsy journey, there were so many red flags that caregivers should have noticed and should have taken action on. And what I mean by that is all three of our kids either have or had epilepsy at some point in their lifetimes. And it all started with our oldest, our son, Nicholas, in 1996, when he was 4 years old. He started having, back then we called them grand mal seizures. Now we call them tonic-clonic. But there were so many red flags, because then at about the same time, our middle child, our daughter Devin, started having petit mal seizures. And then fast forward to 2012, our youngest, Brenna, had her first seizure during a family vacation in New York City. So I'm giving you that background because there's no family history on either side. My wife's side, my side, there's no history of epilepsy whatsoever. So between 1996, when my son had his first seizure, and in 2022, when we lost Brenna, we had been seeing and fully engaged with so many neurologists and epileptologists, too many to count. So that's 26 years of doctor visits, and not once did any of our sons and our daughters, caregivers, ever inform us about SUDEP. And of course, you know, that led ultimately to Brenna's passing on January 30th, 2022 from SUDEP. In 2022, Brenna was thriving in her career as an analyst for American Greetings Corporation. She was absolutely loving her life. She was living on the first floor of a duplex with two of her very best friends, who she went to grade school, high school, and college with. And this is where I try not to live in a world of what if, but what if just one of those dozens of missed opportunities by Brenna's caregivers had been turned into an informational session about SUDEP. And by my count, and it's a rough count, but we had close to 70 doctor visits during those 26 years. And again, not once was the term SUDEP mentioned. We only learned about SUDEP for the very first time a week after Brenna's funeral, when somebody just casually asked us, did she die from SUDEP? And we had no idea what they were talking about. So again, if just once we were informed about SUDEP and the steps that we potentially could have taken to mitigate the risks, then we would have taken those steps. I assure you of that. And Brenna most certainly would have been wearing the Embrace to Watch by Empatica because our son Nick wears it now. And I'm telling you, it works. There's no false alarms. It knows the difference between seizure activity and normal tossing and turning. So instead, though, instead of her roommates sleeping through her death in the middle of the night, their 3 bedrooms, by the way, were situated side by side, separated by just a thin wall. They likely would have been alerted to her fatal seizure, and maybe, just maybe, they could have gotten her out of her prone position and rendered life-saving aid. We'll never know, but I would have liked the opportunity to find that out, which leads me to tell you about our advocacy work. As a family, we were determined to turn our grief into action instead of laying in bed in the fetal position. Last year in 2024, House Bill 229 in Ohio was introduced. It's better known as the Lou Brossard SUDEP Awareness Act. And that bill had a mandate for caregivers of epilepsy patients to inform them about SUDEP and the risk factors and what they can do to mitigate the risks. We were thrilled in January of 2024 when it passed in the House of Representatives by a unanimous 91-0 vote, but ultimately it stalled in the Ohio Senate. So, what we did is we went back to the drawing board. We didn't give up. We worked with Allison. We worked with a lot of organizations like PAME, like Danny did Foundation, and we came up with a revised bill that will next week be introduced simultaneously, or they call it concurrently, in both the House and the Senate. And you're looking at a draft of that right now in our slide deck. And by the way, on a side note, we did successfully get Brenna's Law passed in 2023, which annually designates October 26th as SUDEP Awareness Day in Ohio, but without any disclosure mandates to the doctors. And we chose October 26th when we learned that 1 in 26 people will develop epilepsy at some point in their lifetimes. So it's been quite the journey. It's been multiple webinars, multiple podcasts. We have attended the PAME conference each of the past 3 years, and we will be at PAME conference 2025 in Atlanta also, because this is our new religion. This is our life's mission now, is to inform as many epilepsy patients as possible about SUDEP and the risk factors and what you can do to take steps to mitigate it from happening. Because if we can just potentially prevent 1 or 2 deaths in 1 or 2 families from having to go through this anguish, then it will all have been worth it. Thank you, Allison.
Thank you so much, Lou, for, sharing your story and always being there as an advocate. It means a lot, and sharing the personal stories as we'll hear from Katie, is so important. So we appreciate you being in the community and, your vulnerability and sharing your story with the group. So thank you for being here, and we'll turn it over to Katie.
Thanks, Allison, and thanks, Lou, for sharing your story. Let's go to the next slide. I've had the pleasure of being a part of the epilepsy advocacy community for about 3 years now, and in particular, the PAME advocacy community for about 2 years now. And this group is absolutely amazing when it comes to using, the very difficult things that you've experienced and turning it into meaningful change. So I'm very honored to be here today and to be part of this group. And I just, especially after hearing Lou's story and Brenna's story, wanted to start with, your story matters. I think sometimes more than people might realize. And we have some pictures here of some of the recent advocacy work. That bottom right picture was our PAME Hill Day in Washington, D.C. This summer in July. We had 26 meetings in one day. That bottom left picture is also from that day. It was fantastic, and that was focused just on epilepsy mortality, and we can get a bit into that policy portfolio in just a minute. But also just wanted to speak to those top two pictures as well. We've got a group of PERC researchers and leadership who came to DC on the upper left. And then I think on the upper right there is from the National Plan launch day in February, where we've got CURE and AES and patient advocates all represented. It was amazing. So really, just wanted to start off with your story matters and can have an impact. So let's go to the next slide. So we just wanted to talk a little bit about, what advocacy looks like, before we get into specific policies. But at the very basic level, advocacy is education. So whether we're talking about state level advocacy, which Dominique is going to focus on in the next section, or federal advocacy, the first thing that we have to be doing is educating our lawmakers and our policymakers, number one, about epilepsy, the prevalence of epilepsy, the impact of epilepsy on individuals and their families, and what is within the means of policymakers to change that can make a difference in patient lives and their families. And so once we've built that education and that awareness, that's when we really start to advocate and champion specific policy changes that we believe can make a difference in the mortality space. And that can, range from research funding to specific legislation that affects epilepsy mortality, to coverage changes so that we can be sure that people living with epilepsy can have access to innovations like the Empatica device that Lou was speaking about earlier. So all of those, different changes, it doesn't matter what it is. Once we've educated, then that's when we start to advocate for what we want to change. And that third bullet there is about community. I think sometimes we forget that our voices are stronger together. That it's one thing for a policymaker to hear, about something that's happened to one person in one place. And when we start to bring our voices together and really share the broad impact that shows, that epilepsy mortality affects everyone. It doesn't matter where you live. It doesn't matter your race. It doesn't matter your, socioeconomics. It affects everyone, and we combine our voices together. That's when we really are able to make a change and to make a difference. So all of this to say, your story matters, and your voice matters, and together we can influence policy. So let's go to the next slide, please. So when we first started working together on advocacy several years ago, we wanted to look at, and I'm not going to get too specific into state stuff because Dominique is, but there were various things happening in different states. Legislation looked different depending on what state you were looking at, but families really wanting to channel their grief into something positive. Lou said it really beautifully. If we can prevent one or two deaths, if we can prevent a family from going through what others have experienced, it would be worth it. And so we looked at PAME to put together a toolkit that would put resources together so that if someone or a family wanted to go to their state legislator, to their lawmaker and say, hey, here's our experience and here's what we think would make a difference. We could provide really the footing and some of the base materials to do that. So that was the genesis of the State Advocacy Toolkit. There's a nice little arrow there if you go to PAME's website for where you can find it. Let's go to the next slide and I'll show you a little bit about what it is. But so we wanted to make that education and awareness building is easy for families and for advocates as we could. So you'll see in the toolkit there are a couple of different tools, pieces of material for you to utilize. One is a fact sheet. So really just laying out, and Allison put a link in there, thank you. Really just laying out the basics about epilepsy and about epilepsy mortality. So assuming that someone's walking in to meet with a member of their state legislature or a staffer who maybe doesn't know anything about epilepsy, maybe they don't know that epilepsy can be deadly. We're hitting them with the basic facts and getting that basic information easily understandable. And then also in that toolkit is a one-pager, so maybe going a little bit beyond the fast facts. On the slick sheet is just a little bit more meat on those bones, a little bit more fact-based beyond what what the issues are and where can the government come in and make a difference. And that's the piece of paper you see on the right-hand side there. And then in the middle is the policy proposal. So we literally list out like here are the policy changes that you can work on, so that oftentimes we have a busy staffer who they don't have time to do their research, to look at other states' bills, to cherry pick what they want to include. So we try to give you everything right there to hand to them. They might not include all the pieces, but we try to make it a one-stop shopping experience to hopefully make things easy. Let's go to the next page. Or next slide, sorry. So after digging into this state work, we looked at the federal side, and I'll talk about what those policy pillars look like in a minute, but we developed one-pagers for our federal work too. And I just wanted to highlight this. The front looks a lot like the state level ones. Our specific challenges and recommendations are a little bit different, but I love the testimonials that are on the back of the federal one-pagers. We have two different versions just because we wanted to be able to highlight more stories from our community. But I think this is one of the really special things about the federal part of this toolkit. And you see Brenna there, her beautiful face on the left. But showing, even if we're not in front, we don't have a constituent in front of a lawmaker, really being able to see that these are real people, these are real families, and that this has real impact and we need to do something about it. So let's go to the next slide. So just in the federal arena, I wanted to share a little bit about the National Plan for Epilepsy Act. If you've heard me speak before, you might have heard about this, and so I'm sorry for the repeat, but we are really, really excited about the introduction of the first ever National Plan for Epilepsy Act. It was introduced for the first time in November of last year and then reintroduced in February in the new Congress, which would support the development of a comprehensive strategy to prevent, diagnose, treat, and one day hopefully cure epilepsy. So this is a really big deal. And you can see the priorities that are listed in the national plan on the right side, and SUDEP and other epilepsy-related mortalities is one of those 6 priority buckets, which we're very proud of that. So PAME has been on the Hill advocating for the national plan, working to get more lawmakers to support the national plan. You can see our leads here in the Senate. It's Senator Schmidt and Senator Klobuchar, and then Representative Murphy and Representative Costa. So all members that have been personally affected by epilepsy. Senator Schmidt is very vocal. His son has TSC and is very, blunt about talking about the reason that he ran for Congress and the reason he became a senator is to help people like his son and to give a voice for those, who aren't able to speak out. So we're really proud and lucky to have these 4 champions in our corner, pushing for this national plan, which we'll continue to be advocating for at the federal level. And let's go to the next slide. So beyond the national plan, I just wanted to talk a little bit about the policy pillars. All of these fall into that SUDEP and epilepsy mortality bucket of the national plan, but there are other ways to get at this as well. And so one obviously is increasing funding for SUDEP research at NIH. We are in tough times right now when it comes to research funding. The Senate actually put forth more funding than we were expecting in their FY26 budget proposal. We haven't seen the Houses yet, so there's a ways to go, but really advocating for robust funding for SUDEP research at NIH. I think one of the compelling points that we've been talking about is that epilepsy research informs so many other neurological conditions. We've been seeing that SIDS and SUDSI deaths may be first-time seizures. So I think we're really at the tip of the iceberg when it comes to research, and we need more funding for that. And we've been talking a lot about education and looking at how other chronic diseases are managed. Diabetes is a really great example. If you or your child are diagnosed with diabetes, you don't leave the hospital until you've had a pretty comprehensive education session on how to manage your disease and how to mitigate risk. We don't have that in the epilepsy space, and really believe that that's necessary, and it is a right of someone diagnosed with epilepsy to understand risks and possible ways to prevent those risks. So working on reimbursing that education so that it's more likely to happen and hopefully becomes a part of the diagnosis protocol. And then finally, surveillance, protecting the registries that we have and expanding them so we can better understand the true burden of SUDEP and epilepsy mortality. The numbers that we use, the numbers that we have, we believe are very likely to be undercounts, since we don't believe we're recording all of these deaths. And so until we can accurately convey the true burden of SUDEP and other epilepsy mortalities, it's going to be harder to get the funding, the support, the research that we need. So really working on that surveillance work as well. I think that's my last slide. I do want to conclude with I've been looking at who we have on the webinar today. Some of you I've had the honor of working with, of meeting with, of advocating with. If you are looking to get involved in federal advocacy, if you'd like to meet with your lawmaker, if this resonates with you, please reach out to Allison, reach out to me. We would love to loop you in and progress this. So thank you so much for having me. I appreciate it.
Thank you so much, Katie. We appreciate it and hearing all the work that's been done. And it's always great to see photos of what's been going on too. So thanks for sharing those. And now let's go to Dominique to dive deep into the state work. But also, like Katie said, if you hear something and you want to get involved as you're hearing from our presenters, please feel free to, reach out, send me a private message, anything like that. And I'll collect that information and we'll definitely follow up with you. So Dominique, over to you.
Hi, thank you, Allison. So happy to be here. And I just want to, continue to kind of echo what Lou and Katie both said. So we can advance to the next slide. So I want to talk about state advocacy. Katie just finished up talking about some federal things. And I just really want to, drive in that state legislation is a powerful tool to leverage public health. On the state level, it determines how health education and services can be and will be implemented. As we, said throughout this call, SUDEP and epilepsy mortality is underrecognized in the public health space, especially on the state level. But state level action can lead to concrete changes that could potentially save lives. And real change starts with state advocacy. That's where a lot of the national policy movement happens. Like Katie mentioned, after they developed the toolkit, then they started looking at pillars for on the federal. So things that are happening at the state level can definitely drive things that are going to happen on the national level. Next slide, please. Katie briefly touched on the toolkit, but I just wanted to kind of go deeper into what suit up legislation looks like on the state level. It's very similar to the federal pillars, that public awareness, coverage, provider education, and death investigator education. So for public awareness, we really advocate to inform patients and families about epilepsy risk and potential suit up strategies that could potentially save lives. In regards to coverage for education, it provides just reimbursement for the medical counseling on suit up risks, just like Katie mentioned, like for the diabetes education. So very similar, as well as provider education, ensuring that doctors and nurses that they're equipped to discuss with the families about epilepsy mortality risks. And then death investigators, it enables for us to have a more accurate death certificate data as well as suit up identification, because we know that data drives policy change. So really having that accurate information will help drive additional policy change in the future. Next slide. This slide is just a current landscape of enacted laws that have happened over the last several years. In those pillars that we've been talking about throughout this webinar, the medical examiner's education, we have, Connecticut and North Carolina, they've enacted laws that would require medical examiners be educated on suit up, so that if a death occurs, that they're able to code it correctly. Autopsy mandates are happening in Illinois and New York. Awareness, Ohio. Lou mentioned the Suit Up Awareness Day on October 26th. And then we have the disclosure to patients in New York, where it just informs a patient about that suit up. That's very similar to that the provider education, where doctors and nurses have the information that they need in order to inform patients about the suit up risk. Coverage, Minnesota is the first state to enact coverage, Medicaid coverage of the seizure detection device. The Epilepsy Foundation, in support of that, we're scaling that on a national level to advocate for additional coverage in all states. Surveillance and registry, again, Katie touched on that around just ensuring that we have that data. So Minnesota recently passed a law last year that would establish a Minnesota epilepsy program that would require the Department of Health to collect data. Kentucky already has a registry. So again, advocating to protect those registries, not just on a federal level with everything happening on a federal level, but also ensuring that if it's not protected on a federal level, that in your state, in your backyard, that that data is being collected. And then Oklahoma passed a law, what I like to say is just consider all of the above, because it touches on various aspects of what we would consider suit up legislation, whether it's just the awareness, we're having your driver's license have a symbol that that shows that you have epilepsy. Again, that is optional if you want that. The medical examiner's education, it also has a public awareness campaign component to it, as well as autopsy mandates. Next slide, please. So the previous slide was all of the states that have enacted legislation, and these are some of the legislation we saw throughout the year in 2025. And these are just states that have introduced the bill, not necessarily states that are actively working, because advocacy is a long process. So you could be actively working in your state for a couple of years doing just outreach, getting to know your members, your representatives on that state level. But these are the states that have actively introduced legislation that PAME, the Epilepsy Foundation, that we're actively supporting. If your state is not listed here, it doesn't mean that there isn't work being done in that state. It just means that there's currently not an active bill or a bill that was introduced. Next slide, please. And so now we want to talk about how advocates could get involved. And I feel like I'm going to, kind of say some of the same things that Lou said and Katie said. But again, sharing your personal story with your lawmakers, to me, that is one of the most impactful things that you can do. Joining a coalition effort. We want to make sure that, joining with PAME, joining with the Epilepsy Foundation or any other partner organization so that there's not a duplication of efforts. We want to make sure that, that you're looping in and, communicating with, other advocates in that space, because numbers also drive change. Participate in advocacy days, letter writing campaigns, social media campaign. You can sign up for the Epilepsy Foundation's newsletter. Oftentimes we push out a lot of grassroots engagement for opportunities to sign on to federal and or state letters. If that's your level of it. If you're not ready to lead, but you just say, I just want to, send an email to my member of Congress or my state representative, you can engage that part. If you're ready to jump in and share your story, join an effort that's already happening in your state, or reach out to me or Allison, and we can get you plugged in on how to start in your state. Next slide, please. And so this is just a call to action. We want to help advocates who are interested in advocating for legislation. So if you are interested in advocating for suit up legislation or just getting involved in the advocacy space, please feel free to reach out to myself or Allison. Allison will be the great point of contact for how to utilize that toolkit. I can get you plugged in with a local office in your state for the Epilepsy Foundation. And if you have any questions or need support on how to work with your legislators, we're here to serve as a resource. And I believe that is my last slide.
Yeah, so thank you, everyone. We have time for Q&A, so I'm going to stop my share so we can see all of our lovely panelists. And want to follow up with Dominique real quick. And if you have any questions, please share them and we can ask them to the panelists. Dominique, I know the Epilepsy Foundation, and you were talking about it, like letter writing and things like that, will do the call to action. Can you talk a little bit more kind of what that looks like, or when those call to actions come out? Because I know we have some people, when they shared their location, that are located in those states that have those bills that haven't passed yet, but are kind of in the works. So what would it look like if they got EF's call to action, and how could they sign up for that?
So we do have a robust grassroots network. So if you're signed up for our newsletter, any legislation that the Epilepsy Foundation is supporting, if we initiate grassroots, we'll send out an email. So if you're signed up, and you're plugged in, you'll get an email, and it's just asking you to reach out to your member, whether that's on a federal or a state level. So if it's on a federal level, it could be, engaging on, the national plan, doing some advocacy work on the national plan, like Katie mentioned, scheduling meeting with your member of Congress. So just getting plugged in that way. If it's a state specific bill, it'd be very similar. We'll send out an alert just asking advocates to reach out to their state member within their state, and we provide all of the tools. So it's already a pre-written blurb. All it asks is for you to personalize it and to share kind of your story in that piece, and it sends from the platform that we use.
Okay. And then one follow-up question to that we just got, what if EF isn't in your state? I know there's location, the affiliates and chapters are in various states, but what if EF isn't in their state?
So technically EF, we serve all states. There may not be a physical presence office, but there is either an affiliate or an executive director or even an engagement coordinator that does serve that state. If you're having trouble getting in contact with anyone in your state, feel free to reach out to me. I work and support all of our states on advocacy on the state level. My colleague Roxanne Yogle, she supports on that federal. So if you're wanting to get plugged in on some state advocacy, feel free to reach out to me. I can serve as that in between to get you plugged in with the local office there.
Perfect. Thanks for that clarification. And then Lou, I wanted to ask you a question, or we just got one for Katie. We talked a lot about, coalition building, building community and stuff like that. Can you talk a little bit about how you did that and, your upcoming legislation and the legislation you did previously in Ohio?
Yeah, absolutely. It's interesting because, advocacy has a lot of different looks for a lot of different people. It could be just as simple as a tribute post, which is kind of how my advocacy started. Uh, the day after Brenna passed, at the time I wasn't on Facebook, I wasn't on Instagram, I wasn't on TikTok. I was on LinkedIn, and so I did a tribute post to my daughter. And then literally 2 weeks later, it had over 1.2 million reactions. And then I was getting contacted by so many other advocates left and right. People like Kelly Jankowski, and I could go on it, John Popovich, I could go on, Sally Schaefer. But anyhow, it just kind of bloomed from there. And so I guess I just want to reinforce a couple of things that Dominique said. Get in front, if at all possible, get in front of your state legislator, whether that's a House member or a senator, because that's what I did. I took an opportunity where in the city that I live, there was a state of the city address being done by the mayor, and our local House representative was in attendance. And after the speech by the mayor, I beelined over to the House member, shared our story with her, and she had tears in her eyes. And from that moment on, she has been a staunch advocate for getting this bill over the finish line in Ohio. So you really need to just advocate with legislators and organizations like EF, like PAME, like AES, like Danny did, and just see where it takes you. And I'll tell you, it's been very rewarding as well, because at this point, I now consider myself a mentor to parents or family members who have recently lost a loved one, because typically they link them up with me. When I say they, people like Allison and other members of the organizations I mentioned. So, Allison, did I answer your question? Because I pulled a Lou, and I feel like I went off the rails a little bit.
No, you definitely answered it, and you're definitely a mentor to those in the community. And I do just want to emphasize one thing you said. You take that shot. Like, you saw that legislator, you went up to them, you talked to them, and I see Dominique and Katie smiling and nodding. When you have those opportunities, you go there. You have those conversations, because you never know what they can lead to. So yeah, I think
Yeah.
that's a really important example that you shared. So,
It's just so much harder for them to say no or show disinterest over the phone or through an email than it is in person. And I don't know how you get in front of them. I just got lucky, but I'd rather be lucky than good sometimes.
yeah. No, great example. And then Katie, I wanted to ask you this question. There's been some chatter about research in the chat you may have seen, and Dominique, you can feel free to chime in as well. But Lisa has asked, we're all probably aware there's been a push to reduce federal funding for research across a number of the healthcare initiatives in general, very specific to epilepsy. Also, as we know, with the CDC epilepsy program, how has that affected epilepsy research? And maybe add in kind of what are we doing to help with that?
I mean, it has affected epilepsy research for sure. NINS, so the Institute of Neurological Disorder and Stroke, has seen significant staff cuts in their folks who handle epilepsy. So there's been that impact there at NIH, which is not positive. The Brain Initiative has lost researchers, so epilepsy is involved there. And then, as Allison noted, at CDC, the entire epilepsy office there was cut. Not just funding cuts. I mean, that's bad enough. But then you look at the Medicaid cuts that came with the passage of the reconciliation bill, which, will have an impact on the epilepsy community, since as, many as 40% of children living with epilepsy are on Medicaid. So there have been some difficult policy changes that have happened over the past several months, which to me mean that the advocacy work that we are doing is more important now than ever before. That lawmakers are hearing about epilepsy, not just from one group, but from multiple groups, are hearing the need for funding for research, are hearing the need for the programmatic work that happens at CDC, and are hearing the impact that these Medicaid cuts are having on their constituents when it comes to epilepsy and otherwise. So it has been a tough funding environment. I do think that makes us all the more determined, to be active, to be present, so that we're not something that's an easy cut because, they're not hearing from us, or we're not the loudest voice in the room. So we've been working to be a loud, present, and visible community during this difficult time.
Thank you for that. And we also have another question, and I'm happy to answer this one, but Katie and Dominique had touched upon some of the legislative work around surveillance with death investigators. But Michelle had asked about how deaths get counted with SUDEP, and specifically the loss of her son, and if it'll be counted as SUDEP, since on the death certificate it was listed as death due to positional asphyxia related to a seizure disorder. So as Dominique had mentioned, and showing some of the work that's been done, surveillance with, counting SUDEP deaths and the education that's done with death investigators is one of the areas that, we're interested in, because it is different across the country, how those are counted. So we know SUDEP deaths are not counted at the level they need to be, and that they're undercounted. So yes, every state is different, counties within states can be different. So that is definitely one of the areas that we want to work better on, because, we want accurate numbers, we want the best numbers. So, that is one of the areas that we're working on. And some families also, after the fact, have gotten death certificates updated to say SUDEP. There's the National American SUDEP Registry, or NASR, where you can talk with them, share medical records, do an interview, and they can look at death records and things to possibly update death certificates. So there are other resources out there. Happy to talk offline with you, Michelle, about those things. But that's why one of the areas, like Katie mentioned and Dominique mentioned, surveillance is one of the areas that we're really focused on as well, with legislation and just education with death investigators. Because if they don't know about SUDEP, they can't put SUDEP on, death certificate. So I don't know if Dominique, Katie, Lou, if you want to add anything to that.
Yeah, so I just add additional clarification. While it says that it was, and again, I'm sorry for your loss, Michelle. I just want to lead with that. The cause of death was related to seizure disorder, because Tennessee doesn't currently have a mandate that classifies for medical examiners SUDEP. It's related to, but it's not, it wouldn't be coded necessarily as SUDEP. I believe that's the specific question that you were asking. So the coding, while that it's not great that your son passed away, the coding, there can be more work to be done if that's what you're asking. I want to be sensitive with how I respond to this.
And I see Lou has come off mute.
And on top of that, Dominique, my advice to Michelle would be, don't just accept that determination. I personally, I don't want to, I wasn't borderline stalker or anything, but I literally blew up the office phone of the medical examiner who did the autopsy on Brenna. And I had several 45-minute to 1 hour conversations with that individual, just imploring them to look into SUDEP as manner of death, because I think a lot of them, I hate to say it, I'm not saying that they're lazy, but I think they just default to simple conclusions such as asphyxia or heart arrhythmia, things like that, and they either don't know enough about SUDEP or how to look for it. I think is probably the prevailing issue that's going on. But again, don't accept it if you don't believe it. So feel free to call your medical examiner. That's what they're there for, in my opinion.
Yeah, and thank you for that advice, Lou. I think that is, good advice to get those answers and all of that. They're there to serve you, I think is the overall message there.
And
Exactly.
that's the same for our policymakers, whether it's the state level or the federal level, they're there for you. You are their constituents. And what's the saying, the squeaky wheel gets the grease. And so we have to be the squeaky wheel.
Yeah. Well, looking at the time, I just want to, thank everyone for all your questions. We're going to have a few closing slides, but I know Lou has mentioned a lot of partners that are in this space together, and Katie too. So, we have PAME, the Danny Did Foundation, Epilepsy Foundation, Epilepsy Alliance, American Epilepsy Society, like whole bunch of partners. And I just see in the chat, stronger together, and we definitely are. So, there are many groups out there to help build coalitions across the country in different states and all of that. So, we're here to support any efforts like Dominique was talking about. So feel free to reach out. And we'll put you in touch. We'll get you connected to folks that might be doing work in your area already, and things like that. But just know, I know some acronyms were said throughout. We're here to assist however we can. And then just a few wrap up slides here. But I definitely want to thank, Lou, Katie, and Dominique for joining us, sharing their expertise and, just really having, a lovely conversation and sharing about how advocacy works, be that squeaky wheel, jump on those opportunities in those town halls or different things like that that you see, and all of that. And yes, I do see we will share the recording. I'll post that on our YouTube and email it out to all the registered participants. And folks are asking about participant emails. So if you are comfortable, I see Lou is already, you can feel free to answer that at your, leisure there. But did want to share our conference, like Lou had mentioned, is coming up in December. So it's December 3rd and 4th in Atlanta. It's held before the annual American Epilepsy Society conference. On Wednesday, we do a pre-conference afternoon session focused on bereaved families. It's our family day. And then Thursday, we have our scientific conference, all-day conference. We have a poster session and everything like that, focused on SUDEP and mortality research and what's new. So if you have any questions like that about the conference, please let us know and reach out to me and we can answer those. We also have our partner, the Danny Did Foundation, that offers travel scholarships to help people attend the conference. So if you're interested in those, we can share more information about their travel scholarships. And then we also launched the PAME SUDEP Research Journal Club this year. So if you're interested in learning more about the new research in SUDEP, I know we had a lot of questions about research when we were talking about it. We get together and we just talk about the research that's going on. So you can sign up or let me know if you're interested. We have 2 more coming up this year, but we will continue this initiative next year because we've gotten a really good response. And I'm just seeing, we will add you, Michelle, to all of these things coming up. And then if there's no other questions, or panelists, if you have any last remarks before we wrap up, and let you have the mic. If you have anything.
Yeah, I just have one parting comment. I've got a regular supporter of mine on LinkedIn and also Instagram, and she always finishes every communication with "make some noise," and I just love seeing that. And she couldn't be any more right about that. So, again, there's a fine line between making some noise and being annoying. But yeah, go out there and make your own noise and band together with however many people you can, because there's strength in numbers for sure.
Well, with that, I feel like this slide should say thank you, and our call to action is make some noise. So thank you for that, Lou, Dominique, and Katie, and we all look forward to making some noise with you in this next legislative cycle. So thank you all, and we'll talk with you all very soon. Have a good rest of your day.
All right. Bye, everybody.
Thanks, everybody. See ya.
Bye-bye.